After the fall of the Roman Empire, Europe lost its grip on centuries of scientific progress. Healing was left to local folklore and untested remedies. Without the foundational texts of Greek physicians like Galen or Hippocrates, medical practice devolved into a landscape of unregulated practitioners and monks working without a formal medical framework. But thousands of miles away, the intellectual center of the world was shifting. A thriving, centralized Islamic empire was actively gathering and translating the world's surviving scientific texts. The survival of these foundational medical theories now depended on scholars across the Mediterranean who were actively translating and interpreting the texts that Europe had forgotten. In the late 10th century, a teenager named Ibn Sina, known in the West as Avicenna, was studying the very Greek texts that Europe had lost. His intellect was so sharp that by age 18 he successfully treated the king of the Samanid dynasty. In return, he was granted access to the royal library, which contained the medical science of scholars from many nations. As he read, Ibn Sina realized that while medical knowledge was vast, it was scattered, contradictory, and dangerously inconsistent. To solve this, he began writing a 5-volume encyclopedia called the Canon of Medicine. Within these pages, he integrated the medical traditions of the Greeks, Romans, Indians, and Chinese into one cohesive, meticulously categorized system. But he didn't just copy the ancients. He mandated that all medicine must be proven through direct clinical observation, establishing a rule of empiricism for every treatment he included. Inside the canon, we find a highly organized record of tested clinical interventions. He documented diagnostic techniques like percussion, tapping a patient's abdomen to listen for a tympanum sound, indicating trapped gas, rather than the silence of fluid buildup. He detailed mechanical innovations as well, using a speculum paired with a mirror to reflect light during precise cervical examinations. For spinal trauma, he described the specific side effects of injury to every part of the spine, from the cervical to the coccygeal vertebrae, and used spine traction to treat neurological complications. These records show the canon was a practical manual of procedures tested on living patients. In urology, he described using specialized catheters to deliver chemical compounds that could crush bladder stones directly inside the body. He also developed a strategy he called lifestyle medicine, which prioritized daily diet, ensured adequate sleep, and physical activity before a physician was authorized to use drugs or surgery. If drugs were required, Ibn Sina established a structural framework for clinical trials to test their efficacy and determine safe dosing limits. By combining anatomical surgery with strict rules for clinical testing, he moved medicine away from a system of guesswork toward a reproducible science. In the 12th century, the scholar Gerard of Cremona translated the massive Canon of Medicine into Latin. When this categorized, empirically driven text reached the West, it provided a structural reference that European physicians had lacked for centuries. At the University of Montpellier, the oldest surviving medical school médicale, professors sought a way to standardize medical practice and end regional anarchy. To build a legitimate institution, Montpellier adopted the entire Arabic medical curriculum as its foundational teaching program. Records from Montpellier show how dominant this knowledge became. Avicenna's works were required more frequently than the combined teachings of Galen and Hippocrates. Of the 16 primary medical books used to train doctors, 13 were of Islamic origin. The Canon of Medicine maintained this position as the standard reference in European universities for over 500 years. By providing a rigorous system of observation and categorization, Ibn Sina established the institutional framework that allowed European medical schools to transform into the organized, evidence-based discipline we recognize today.